What if I told you that the difference between the vibrant life and fighting the serious health issues comes down with the decisions or the choices that you make every single day? Diabetes isn't just about avoiding sugar, it's about understanding how your body works and taking control of it before it takes control of you. Welcome to Med Insights with Rahul, where today we are not just going to talk about diabetes, but we are going to master it. I'm going to reveal the secrets that every expert knows but only few talk about it. By the end of this video, you will be equipped with the knowledge to make your life sweeter without the sugar overload. If you are ready to take charge of your health, hit that like button and stick around. Let's dive in. So what exactly is diabetes? It's a chronic condition where your body either doesn't produce enough insulin or doesn't use it effectively. Insulin is like the key that lets glucose or sugar into your cells to give them energy. Without insulin, sugar starts building up in your blood, like a traffic jam on Monday morning. There are mainly three types of diabetes. Type 1 diabetes. This is an autoimmune condition where your body's immune system attacks and destroys the insulin producing cells in your pancreas. It usually develops in childhood or adolescence, but adults can get it too. With type 1, you are dependent on insulin for life. Think of it as your daily key to survival. Type 2 diabetes. This is the most common type where your body either becomes resistant to insulin or doesn't produce enough. It's usually linked to lifestyle factors like obesity, lack of exercise and poor diet, but genetics also plays a huge role. Unlike type 1, type 2 can often be managed with lifestyle changes and medication, but it's still a serious condition. Gestational diabetes. This type occurs during the pregnancy and usually disappears after giving birth. However, it can increase the risk of developing type 2 diabetes later in life, both of the mother and the child. Now let's talk about causes and risk factors of diabetes. Type 1 diabetes, the exact cause is unknown, but it is believed that it is mostly the combination of the genetic factors and the viral infection that triggers the immune system. Type 1 is mostly out of our control. Type 2 diabetes, the story is a bit different. It is highly influenced by the lifestyle choices. Obesity, especially central obesity, that is belly fat, is a major risk factor. Sedentary lifestyle, not getting enough physical activity can make your cells more resistant to insulin. Unhealthy diet high in refined sugars and sugary foods can lead to insulin resistance. Genetics, family history plays a significant role. If your parents or siblings have type 2 diabetes, your risk is higher. Age, the risk increases with age, particularly after 45, but younger people are increasingly at risk due to rising obesity rates. Ethnicity, certain ethnic groups like South Asians, Africans, and Hispanics have a higher predisposition to type 2 diabetes. For gestational diabetes, it is due to the hormonal imbalance during the pregnancy that makes the body less responsive to insulin. Women who are overweight, have a family history of diabetes, or are certain ethnic backgrounds are more at risk. Symptoms of diabetes can be subtle at first, mainly in type 2 diabetes. Here are some signs to watch out for. Increased thirst and hunger. Your body is trying to manage excess sugar in your blood, making you thirsty and hungry all the time. Frequent urination. Your kidneys work overtime to filter out the excess sugar, leading to the frequent trips to the bathroom. Unexplained weight loss. Despite eating more, your body can't use glucose effectively, leading to weight loss. Fatigue. High blood sugar affects your body's ability to use glucose for energy, making you feel tired. Blurred vision. High levels of sugar can cause the lenses of your eyes to swell, leading to blurry vision. Slow heading scores and frequent infections. High blood sugar can impair circulation and your immune system, making it harder for your body to heal. Numbness and tingling in hands and feet. This could be a sign of diabetic neuropathy, a nerve damage complication of diabetes. If you are experiencing any of these symptoms, don't ignore them. A simple blood test can confirm if you have a diabetes or not. Diagnosing diabetes is straightforward with a few different tests. Fasting blood sugar test measures your body sugar after an overnight fast. A level of 126 mg per dl or higher indicates diabetes. A1C test. This blood test provides an average of your blood sugar levels over the past 2 to 3 months. An A1C level of 6.5% or higher indicates diabetes. Oral glucose tolerance test measures your blood sugar before and after you drink a sugary solution. A blood sugar level of 200 mg per dl or higher after 2 hours indicates diabetes. Random blood sugar test. A blood sugar level of 200 mg per dl or higher regardless of when you last ate suggests diabetes. Treatment for diabetes varies depending on the type you have. Type 1 diabetes. Insulin therapy is a must. This can be delivered through injections or insulin pump. You will need to regularly monitor your blood sugar levels and follow a balanced diet. Type 2 diabetes. Treatment often starts with lifestyle changes like diet and exercise and may include oral medications like metformin or GLP-1 receptor agonists. In some cases, insulin therapy might be needed. Gestational diabetes. This is usually managed with a special diet and exercise plan. If needed, insulin or oral medications might be prescribed to keep blood sugar levels in check. Managing diabetes also involves regular monitoring of blood sugar levels using devices like glucometers or continuous glucose monitors. The key is to maintain a balanced diet, exercise regularly, and follow your doctor's advice. So now let's talk about what can happen if the diabetes isn't managed properly. The complications can be serious, so it is important to stay on top of your condition. Cardiovascular disease. Diabetes significantly increases the risk of heart disease, stroke, and high blood pressure. Kidney damage, that is neuropathy. High blood sugar can damage the kidneys over time, leading to kidney failure. Nerve damage, that is neuropathy. This can cause numbness, tingling, pain, and even loss of sensation, particularly in the extremities. Eye damage, that is retinopathy. Diabetes can damage the blood vessels in the eyes, leading to blindness if untreated. Foot damage. Poor circulation and nerve damage can lead to the foot ulcers, infections, and in severe conditions, amputation should be done. Skin conditions. People with diabetes are more often prone to bacterial and fungal infections. Hearing impairment. Diabetes is linked to an increased risk of hearing problems. Alzheimer's disease. Type 2 diabetes may increase the risk of dementia and Alzheimer's disease. But don't panic. With proper management, you can live healthy and active life with diabetes. It's all about keeping those sugar levels on check and avoiding the complications. Living with diabetes isn't as tough as it sounds. It's all about making smart choices. Here are some tips. Diet. Focus on whole grains, vegetables, lean proteins, and healthy fats. Avoid sugary drinks, processed foods, and excessive carbohydrates. Exercise. Aim for at least 30 minutes of moderate exercise most days of the week. Walking, cycling, and even swimming are great options. Regular monitoring. Keep track of your blood sugar levels as recommended by your doctor. This will help you make the adjustment to your diet, exercise, and medication. Stress management. Stress can affect your blood sugar levels. Practice relaxation techniques like yoga, meditation, and deep breathing exercises. Regular health checkups. Don't skip your regular visits to the doctor. Regular screening can help catch complications early. And remember, you don't have to do this alone. Support groups, dietitians, and healthcare team are all here to help you stay on track. Before we wrap up, let's burst some common myths. Myth number 1. Eating too much sugar causes diabetes. Not directly. Type 1 is genetic and autoimmune, and type 2 is more about insulin resistance influenced by multiple factors. Myth number 2. People with diabetes can't eat carbs. False. It's about portion control and choosing complex carbs like whole grains. Myth number 3. You only get diabetes if you are overweight. While obesity is a risk factor, even slim people can develop diabetes, especially type 1. Myth number 4. Diabetes isn't serious. Tell that to the complications. Diabetes is a leading cause of heart diseases, blindness, kidney failure, and amputations. Knowledge is power. You have got the facts to take control of your health. So there you have it, everything you need to know about diabetes. If you would like the video, please like, share, and subscribe. And until next time, keep your sugar levels and your spirits balanced.